الزملاء الأعزاء، السلام عليكم ورحمة الله وبركاته. نرجع اليوم وياكم بحلقة جديدة من توك2Walaa مع أخوكم دكتور ولاء المولى. قبل ما اليوم نعرفكم بزميلتنا دكتورة إنعام، اليوم بس أتمنى من الكل أن يدعي الدكتورة صباح زميلتنا إن شاء الله بالشفاء العاجل. أعراضها أعراض كورونا، بس إن شاء الله ما تطلع كورونا ان شاء الله. يعني الكل يدعي لها بنيه صافيه وبقلب طيب، لانه صراحه تعرفون كلكم هي تحبكم كلش. وطبعا دزت تحيات، قالت ان شاء الله الكل بخير وبصحه وسلامه. اليوم حلقه كلش رائعه واستثنائيه من دكتوره انعام عباس. دكتوره عراقيه ساكنه في يوكي، وطبعا هي تدريسيه وتنطي محاضرات بالتريننج مال رويال كولج. هسه دكتوره راح تكون ويانا على الخط بعد هذا الفاصل. دكتوره السلام عليكم.
عليكم السلام ورحمة الله. أهلا دكتور.
شلونكم؟ ان شاء الله بخير.
الحمد لله. أنت شكرا.
اخبار كورونا ببريطانيا؟
well yeah fine الحمد لله، يعني شوي بدينا نتحرك، وبس طبعا لازم الماسك والسوشيال ديستانسينج وهاي الأشياء، ولازم يعني
الجامعات مفتوحه عندكم؟ كل شيء مفتوح؟
no. نشوف المرضى يعني على السكايب وعلى الزوم وهاي الأشياء، يعني أونلاين أو على التليفون. هذا المرضى بس يعني إذا مستعجلين يعني emergency نشوفهم، نروح للعيادة ونلبس كل شيء. بس التدريس لا، لسه بعد على الأونلاين، كله أونلاين بندرس.
الله يحمي ان شاء الله الكل. يعني صراحه هي صعبه، كلش صعبه. تشوفين انت الوضع يمنا شلون، وخطيه دكتوره صباح يعني هي بدها تشتغل بالمستشفى، خطيه صار عندها سخونه وكذا، فاحنا شكينا، فهي راحت فحصت. يعني بعد لحد الان نتائج مو 100%، بس ان شاء الله ندعي بانه تكون مو كورونا، واذا كورونا ان شاء الله يشافيها ان شاء الله.
إن شاء الله إن شاء الله يا رب، ندعي لها بالشفاء العاجل وكل المرضى. وأتمنى إنه يعني الوقاية أحسن، إنه الواحد يعني يدير باله يلبس الماسك والسوشيال ديستانسينج 2 متر or more، and يعني ما يصير شو يسموه هذا، ناس يعني تتجمع. فهذا أحسن شيء.
ان شاء الله. دكتوره محاضره اليوم امين ان شاء الله، والمعنويات العاليه للكل، وان شاء الله يشافي الكل، لانه صراحه يعني هو فد شيء نفسيا مو حلو يعني، والا الحمد لله نسبه الشفاء يعني كلش عاليه تقريبا. يعني بس بهالفتره هاي العراق 3800 شخص الحمد لله تم شفاء يعني.
الحمد لله. اي ان شاء الله، بس يعني you have to يعني الواحد يتعود عليه، وانه هو موجود راح يطول فتره طويله، وانه الواحد يكون يعني يتعامل بطريقه جديده مع العلاقات، شوي يبتعد، وهذا شوي يقلل العدوى. يعني ان شاء الله الكل يكون بخير وسلام
ان شاء الله ان شاء الله. دكتوره انطينا فكره عن المحاضره قبل ما تحضرنا اياها وتخلينا اياها على الشير سكرين.
المحاضره يعني it's about the examination of Royal College of Surgeons and Physicians. Royal Colleges, we have 4, of course, in the UK: London, England, Glasgow, Edinburgh, and Dublin. But you know, mainly people, they want to do the England one, and some of them they like to do Edinburgh or Glasgow. And there is now, it was last month, there are many like change to the exam of Royal College of England. We will mention that later, inshallah. If you have any questions, just let me know. You can write it down, or you can say it later or now. And the examination is about, you know, before now, maybe 20 years ago or 30 years ago, it was about qualification of surgeons, physicians and surgeons in all of the world. But in Iraq, it was qualified to PhD degree or doctora. But now I'm not sure what is the qualification in
It's a
Iraq.
diploma, doctora, high diploma.
Anyway, if it is diploma or master degree or PhD, it is qualified to board exam or PhD.
But you have, doctora, every time when we speak about, when I talk with you about Royal College, you said something very nice. You said if you have this certificate, you will be like
A king.
great.
Yeah.
اسمعوا
If
يعني
you have
يصير عندك confidence، يعني هي هاي الفكرة.
this if it is diploma, it's fine. This kind of certificate of diploma or board exam, anything you can say anything. When you feel like you know everything in dentistry, you are a physician, you are a surgeon, and also you feel like you are a queen or a king. That's my feeling now. After passing it, of course, after passing many exams. It is not this examination is not difficult, not hard. It's also not easy. So you have to prepare yourself well, and you have two ways. Either do like courses with recommended people, recommended tutors, or you can do it yourself. If you do it yourself, you will take a long time, of course, because you don't know how to do it and what the expectation, what the examiners expect from you to do. And if you do it with a tutor, a recommended tutor, of course, it will be better for you because the tutor will guide you, of course. And nowadays there are millions of like resources, books, resourcing courses, people uh, writing information on the Facebook groups, WhatsApp groups. I don't know, social media. I mean, uh, you cannot take everything in once, and also it takes a long time to understand everything, and this is not good. If you follow my advice, this is not good to believe everything on the social media. You have to follow our recommended people like tutors or examiners or yeah, or even your teacher.
Great. So doctor, shall we start?
Yeah,
اوكي.
but all right.
دكتورة، تريدين حضرتك تشيرين من يمك السكرين لو اني؟
If you can do it yourself.
اوكي. My pleasure.
You have the PDF, yeah?
Yeah. حبايبي، هذا اللي راح تشوفوه هو الكي اوف سكسس ان شاء الله بالرويال كولج بريباريشن. ان شاء الله الدكتوره ما تقصر ويانا. دكتوره، it's yours now. أنا راح صوتا راح اطلع، يعني ما ابين، بس حضرتك البرزنتيشن.
So
تمام.
okay. All right. So can you put it bigger or
اي I will do it.
full screen and also yeah. All right. So I don't hear you. I will start now. Can you do next, please? Dr. Wala, can you do next page, please? All right. This is about the Royal College of England, Glasgow, Edinburgh, and also Ireland. There is another one, but it's up to you if you want to do the other one. It's up to you. Dr. Wala, can you move it, please? Yeah. So the first thing is about Royal College of Surgeons. The aim of this examination, first examination, is MJDF. MJDF, Royal College of RCS, Royal College of England, is to assess your knowledge and also application of knowledge and your understanding of the structure of the dentistry, because you are a dentist first, you are a doctor, you are a dentist, and also you want to be you want to get a training in surgery, of course. So that is the requirement depends on your practice. You have to practice like 2 years after you finish graduation, and then you have to have you have to do something in the hospital or in your clinic, and then it is also academic experience and skills. So both. Standard of that examination, of course, I said that you have to do 2 years, at least 2 years foundation program. Foundation program is like we call it in some countries, we call it foundation program. In some countries, like in Iraq, they said, what you call it? A rotation. Yeah. And whether you are now doing your career, like you are a specialist or you are a general practitioner or you have your own clinic or you are doing any work at the hospital or any training, of course, you can apply for the examination. So it is either if you primary or secondary care, like primary NHS, like in the hospital, secondary, like I don't know, you don't have this system in Iraq, but we have this system here. It's like your your clinic or your hospital, so something like that. So anyway, if you are working as a general practitioner or as a specialist or you are on training, you can apply. It doesn't matter. All right. Next, please. And also, there is no limitation of the attempt. You are eligible anyway. You are eligible if you apply online nowadays because of coronavirus and COVID-19. You may apply. You could apply online. Everything is online, which is good. Now you don't have to send your documents and etc. via the like post. And yes, we after you finish the examination, after like part 1 and part 2, when you finish, so you can be a member of Royal College of Surgeons, either England, Glasgow, Edinburgh, or Ireland. Next, please. Okay, now the remote examination. It was last month announcement was about the examination part 1, because usually you have to go to the location or the center of the examination to do the examination. But now, because of coronavirus, you cannot go. So you are doing the examination via, I don't know, they will send you the announcement via camera, and you are at home, and they will send you instructions, and you may do it at home with the put camera, of course. Somewhere they will see you to control you, and then they send you the examination on the computer online. I don't know, this is the first time. I'm not sure how about the steps, but it is now online. So hopefully you will pass. If you have already applied for the examination, hopefully you will pass this exam. It is maybe because it is the first time, maybe it's stressful, but inshallah you will pass it. Second thing is the MJDF MJDF is London. MJDF part 2, when you finish part 1, inshallah, you will do part 2. So part 2, so it continued till the last one will be February 2021. Because there is a decision from the Royal College of Surgeons of England to do it like MFDS and FDS. So I cannot explain that in a couple of minutes now. Maybe in the future we can give more information, or you can go on the website and you see more information about that. But MJDF till February next year will be changed to MFDS. So if you do MFDS, MJDF part 1 with England, you can finish it with England as well as MFDS. Next, please. So the new one is a bit. I cannot say it is harder or easier. I'm not sure about that. It depends on your experience, on your skills, on your understanding of, on your preparation as well. So part 2, part 1 is the same. It is MCQs, and they will give you a scenario. I have examples here. They will give you a scenario, and with five answers, you take one. And then, of course, your English should be very good. And also, when you pass the part 1, part 2, there is a change. I see now there's a change in part 2, because part 1 in MJDF were skills, like you do something like suturing or flap, etc., surgery, a biopsy, how to take a biopsy, and etc. But now you just do with the patient. So the modules, if you decide to take a course with a tutor, so the tutor should explain that to you before you enter the exam, and of course the tutor should be able to give you the modules, and of course we have modules and we have curriculum. Then applied clinical investigation, and then diagnosis. You have to be able to diagnose anything. So of course, in this case, your medicine and your general surgery and oral medicine and your oral surgery, pathology, oral pathology should be fantastic, and also X-ray. And then you have to know, you have to be able to gather information from the patient, like taking history, medical history, dental history, and social history. Then you have to be able to give to deliver the diagnosis and treatment plan, and discuss that with the patient, get permission, and we call it a consent. And then you have to be able to do the investigations before giving any, I give you an example. For example, if you go on a Facebook group, and some people, they put like a picture and they said, what is the diagnosis? Maybe it's okay. You may say this is candida infection, this is cancer, this is whatever. When you do this exam, even if you know the diagnosis, you cannot say this is the diagnosis. You fail. You fail. To give any diagnosis, you have to do your investigation. Even when you finish the investigation, you are 100% sure, plus clinical, what you see clinically on the patient, inside the mouth or outside, general health, social history. Then you give the diagnosis. So investigation are very, very important. Don't say this is a cancer or this is a candida infection, and you are not sure. You didn't do any investigation. Investigation means you know the investigation. So I will not explain the investigation tonight. And then management. Management, you have to know about management because you are taking the exam in the UK. So you have to know how to manage the patient in the UK. So put in your mind the patient in the UK, you have to follow the regulation of the Royal College of Surgeons, plus the ethics and law, in this country, and also the guidelines how to prescribe a medication, how to discuss the treatment plan with the patient, and also how to like take the consent from the patient to do the treatment. So all of that are very important. Um, we if you ask me, maybe I will explain more about that, but those are the modules which are very important. So if you do any course, you have to do those to cover everything: general medicine, general pathology, oral pathology, oral medicine, oral surgery, and other things related to dentistry, and also pharmacology. So we have here books, some books here. Some of you, maybe you have already started with somebody else, or you have started on your own. You have those books or some of those books. I just put some samples, but you may get more. Maybe you have more books. Next, please. So some people say, am I eligible for that award, for the diploma? I cannot explain that in a couple of minutes. You have to be able to contact them via, if they have an email, to contact them through the email, because now, or call them, because now you know you cannot send anything with the post. Maybe if you want to send anything with the post, by post is fine, but the best thing is the email. So if you have any doubt or any question, you can ask them. Next, please. Now, assessment structure, part one is examination. The examination will be held at least twice a year. So that is good. Every 6 months you have one examination. If you fail, so you may do another one. The next one you can both pay your fee and then do the next one. And it's also yeah, the same. The attempt, I think there is no attempt. I think with England there's no attempt limitation, but with Glasgow I think there is. So you should contact them and ask them before. And the other thing is part one is multiple MCQ. Yeah. Next, please. The examination may be taken at any point within the clinical dentistry. That means if you are working now, if you are doing your training now, it's fine. If you are not working, if you do not work, it's fine. You may do the examination. If you are registered, you may do the examination. And then, but you have to show them to prove, to give them, show them a proof that you are like, you have finished 12 months or a year after graduation. Yeah, you have to have some clinical experience, right? Next, please. This is an X-ray. This is kind of MSQ. You may see something like that. They show you an X-ray. The question here is, what is the age of the patient? That is, so you have to be good in anatomy, and you have to be good in embryology. That is embryology. Next, please. And then again, you have to have full-time or part-time. Is up to you. If you are doing full-time job or part-time job, is up to you. You have to show them a proof. They will ask you, for approved that you are working like reference, or if you are doing something in the hospital. When you pass, of course, when you pass part one of the examination, that means you have to prepare yourself, because there is a requirement. If you are doing MJDF now and you finish MJDF now before next February, so the requirement of part two are different. Be careful. MFDS and MJDF, the requirements are different. So you have to be careful with the requirements. Of course, you may ask the tutor. Next, please. I'm talking about MJDF. So MJDF part two is first thing you have to finish. You have to pass MJDF part one or MFDS part one from Glasgow or Edinburgh. It's fine. If you pass Edinburgh or Glasgow or Ireland and you do MJDF London, it's fine. I mean part two. Next, please. This is a kind of MCQs. This MCQ is like just a sample to show you that they give you the scenario as a patient, and they give you some kind of history or some kind of medical issues, and it's about hepatitis B. So you have to know the hepatitis B. That is kind of pathology, and how to read the biopsy. Sorry, the blood test. Even biopsy, of course, pathology. This is a blood test. So it's kind of MCQs. Next, please. Again, you can do it twice, and twice every 6 months. And this is MJDF. So you have plus we have something else adding to MJDF, which is communication skills, clinical competence, and clinical reason. If you do the MJDF, if you do not do it, so if you do MFDS, so that is not like, this is different story. Yeah. So communication skills, that means you are talking with the patient, of course, in English, and clinical competence that, for example, suturing, biopsy, flap, and also clinical result, like how to take X-ray, how to read X-ray, like the X-ray I show you, how to read the X-ray, for example, to give the patient age, to see if there is some, for example, assist, like granuloma, cancer, anything in the bone, level of the bone, the maxillary sinus, etc. That is something clinical. Yeah. Next, please. It's again when you pass, so you get the membership, and if you fail, don't worry, because you can repeat it. So it is, but you have to ask them about the attempt. How many times can you repeat it? For example, I'm not sure about the glass, but I think 4 times. I'm not sure. Next, please. So if you want, yeah, nowadays I told you, because this is of coronavirus and COVID-19, so everything is online, and you go on the website, either Glasgow, England, yeah, or Edinburgh, and you follow the the instruction, and then you apply. And I think you send some scanning of your documents, etc., and passport and everything, and they will accept it. Next, please. Also some books. I like this one, the master collection. I like it. And also, you remember the book that we call the blue book, Oxford book, the blue one and pink one. Those two books are very important and crucial. And I think everyone has that nowadays. Next, please. To attend part 2, of course, you have to be a part 1. They don't mind about the experience, but part 2, they will ask you to send them or to show them references about your experience. For example, if you are working in a hospital or a private clinic, even private clinic is fine. They will ask you to show them like you are working now or you finished foundation, and then they don't give you, for example, you don't have any experience, you don't work, they don't give you the diploma. So be careful with that. So you have to work. And then the part 2, you have to finish part 2 within 5 years of passing part 1. For example, if you finish part 1 now, today, you can't, you have a chance to finish part 2 within 5 years from today. Easy to understand. Yeah. Next, please. Okay, the following, there are some exceptions, like between the faculties. When you finish part 1, MJDF Royal College of London, you may do the second part or part 2 with Royal College of either Edinburgh or Surgeons of Glasgow. It's up to you. All right, so it is okay if you do the second part with other or 2 schools or faculties. It is fine. Next, please. So if you are successful, hopefully, you will attend the MJDF diploma. They will send you, of course, an invitation to come to London. Of course, they will give you a visa to go to the either to part 2 examination or to when you finish to give you the award. And of course, after you give or pay the fee, the annual membership fee, yeah, of course. And then they will give you the title, which is MJDF RCS England, and you will be the king and the queen. Next, please. The college is able to produce visa, of course. They will send you a visa. It is easy. And then you need to, I think you may, for this day, you may have a visa for 2 people as well, or your family. So it is fine. So to travel to London or Glasgow or Edinburgh, it depends on your membership, of course. Hopefully. Next, please. This is also an example about anesthesia. So anesthesia is very important. That is kind of physiology and anatomy. So you have to be good in anatomy and also in physiology. A bit of physiology, but because you know Anesthesia, it is physiology, and anatomy is anatomy, surgery. Next, please. MJDF consists of parts 1 and part 2. Candidates will normally allow a maximum of 5 years in between to complete all or parts. From today till you finish part 2, you have 5 years. It's not like you may, if you try many times, you may finish before 5 years, so it is okay. And the part 1 is 1 paper. For example, if you are doing part 1 in October online, so it is 150 MSQ, and then the questions, which is very good. The questions carry equal marks. That means before in the past was not like that. It was very hard and very difficult. Now it is okay, so equal marks. If it is if you have 50-50, I'm not sure if it's 50-50 or 60 or 70, I'm not sure, but I just saying an example. If the pass mark is 50 and you have 50 correct, so you pass. That is an example. I'm not sure about the mark or the passing mark. And there is no negative mark, which is good. Next, please. Now, as we said, there's no negative mark, and which is very good. In the past was very hard. They used to use negative mark. The part 2, it consists of skills, as I said, professional skills like suture, flap, biopsy taking for like if the patient has cancer. Also, how to do communication, how to talk with the patient, and how to collect information like medical history, dental history, social history, investigations, biopsy, everything. And then you have OSCEs. We call it single circuit station. So it is 14 station. Maybe they may change it. I'm not sure, because if they change it to MFDS, they may change the stations or the same thing. I'm not sure, but it is 14 now. And you have OSCEs. That means you are talking with the patient, as we said before. Next, please. Now this is very important. I like this book. Is about X-ray. If you have it, so fantastic. It is good. It contains everything. The content is very nice and easy and with pictures. So I like it. If you have it, so you may use it for any exam. And it's about how to read the X-ray, kind of X-rays, etc. Yeah. So if you have any question, of course, you may ask me, and or you may write it down or ask Dr. later, and he will send it to me. Good. Now we have specimen part 1 question MCQs. Like, for example, a patient, they will give you the age of the patient. They will give you some of medical history, some of dental history. For example, this patient had bleeding gums, and they will give you the PPE score, which is 313143, and they will ask you about the treatment, maybe about the treatment, maybe about the diagnosis, maybe about the biopsy investigations. So they give you some hints, like the age. He is a male, and the complaint is bleeding gum, etc. And they may give you some signs and symptoms. So your English should be good to understand the question. All right. Next, please. So the answer is about the X-ray, how to take the X-ray. you have to be good in X-ray and how to do the X-ray, and also the kind of X-ray. For example, the periapical, you have panoramic, you have many kinds of X-rays. Again, this is another is about bite wings, for example, horizontal, vertical, and maybe a section, maybe full mouth. So you have to be good in X-ray. Next, please. Again, this is another example, 36 years. So you have to check the age of the patient, if it's male or female, if the patient had medical history, had social history. For example, the patient with family history of something like that, diabetes, if he's taking any medication, etc. Here, the patient is taking warfarin. She is a female, sorry, and she's for a long time with warfarin. So you have to ask yourself why she's taking warfarin. Because she has something in the blood. She has a problem in the blood. Why she has a problem in the blood? She has AF, atrial fibrillation. So you ask about the investigations. Investigations, probably you know about warfarin and bleeding and blood thinners and etc. And you may know about the new warfarins in the market. But others, they don't know anything about warfarin. They don't know about medication. So you have to be good in pharmacology as well. Pharmacology and how to use the medication and why do you use the medication. So you have to be good. You should be able to understand how to use the medication, how to prescribe the medication, and why the patient is taking that, and is the patient controlled or not. So that is kind of medicine and general medicine and pharmacology or therapeutics. Another example, patient, he is old and female, and also they give you like antibiotic, kind of antibiotic. So when you have a patient with warfarin, you have to ask yourself which one is more risky, is asking for giving information or like giving an antibiotic to the patient immediately, or probably you have to check the interaction of warfarin. This is an example. Warfarin, of course, this is not what warfarin is an example. So interaction of medication and, for example, painkillers, especially we use painkiller when the patient had pain. So you have to give painkiller. It is about interaction between any medication and painkillers and antibiotics. Another one is the age here. The patient had a problem of discoloration. So we have many kinds of discolorations, many type of discolorations. Yeah, next is fine. It's fine. Don't worry, I finished that. The patient with discoloration, so you have to be able, should be able to explain the cause of the discoloration, and also the treatment plan, and what is the reason of discoloration. Because many people, if you start from tea and coffee and smoking, this is simple, till you get the very bad discoloration due to fluorosis or tetracycline, etc. So, or either some medication that can cause, or food stuff like coffee and tea. You have to be able to understand the discoloration and why that happened, and explain that to the patient, and also you have to give the answer in maybe 30 seconds. So your speed, your tempo, or your speed should be high. So it is kind of practice. Next, please. Your tempo should be high and your speed should be good enough to yeah. Next please. So this one was the discoloration. You have also to you have also able uh, to give the treatment. For example, if the patient is, if you have a patient now in your clinic and he is about to ask you about he has problem with discoloration, and you give him like all veneer, full veneer all over his teeth. Maybe this is acceptable in your clinic, but during the exam this is not acceptable because you have to see, you have many reason why do you give this, why you, in this case it gives you many examples like veneers, like uh, crowns, full coverage crowns, micro operation, etc. It depends uh, on the age, this like the reason as well. Next, please. I mean, you have to follow, if you manage the patient, you have to follow the guidelines of the Royal College of Surgeons. It is not your opinion, not my opinion. It is, we have Royal College of Surgeons guidelines. It is guidelines, not my opinion. Um, also, a good example of flap. The patient has, for example, repeated absectomy, or the patient is like the tooth is anterior tooth and there's no chance to do the root canal treatment and you have to do the absectomy. Which kind of flap you have to do? So you have many kinds of flap. You have to choose one. Maybe in 40 seconds. So you have to be good in English. Your English should be good, and also your diagnosis and treatment plan should be fantastic. Otherwise, you will lose the score. Hopefully not. Next, please. So you have to be good in surgery. You have to be good in general surgery and also in oral surgery. Um, this one is periodontitis. Periodontitis is a surgery. It is surgery. Periodontology is surgery. So you have to do. It is not like just scaling and polishing, and that's it. No, periodontitis, especially periodontitis. So periodontology is a kind of surgery. So it is surgery. You have to know pathology as well because you are talking about the cause of the periodontitis, which is bacterial microbes. So you have to know microbiology as well. Which kind of microbiology, and also which kind of lab you are going to do to treat this patient. And also periodontology is related to medication. Most of those patients who are chronic or severe case or severe gum disease like periodontitis, they have either family history or they are taking medication like diabetes, they have diabetes, or plus, of course, poor oral hygiene. So it is surgery. Next, please. Surgery, pathology, microbiology, and also preventive dentistry. Preventive dentistry is also a very crucial or important thing. And you have to know the guidelines of the college. Then we have resources. We have the curriculum, as we mentioned. We have modules, curriculum that we follow. Of course, the Royal College of Surgeons, they give you, if you apply to do the examination, they give you the list of the modules and the list of the books. But to be honest, nobody can read all of that because you may take 20 years to finish everything. You cannot do that. That's why if you follow the advice of the tutor or tutors. Of course, that would be better. You may pass the examination quickly. Next, please. Because you are responsible for every single thing. So textbooks, for example, I put many textbooks that they ask, they may give you, but to be honest, nobody can cover all of that. Nobody. So you have to cover everything like anatomy, biochemistry, etc., histology, pathology, everything. Medicine, general surgery, anesthesia, everything. Even if you are very genius, you cannot finish everything, all of that in 20 years. It takes time. So to be honest, to go or to follow the advice of the tutor, that will give you a better chance to pass early. Next, please. All the books, of course, as I mentioned, all the books you may buy them from Amazon or locally from the local shop, or you may, it is not a big problem. Nowadays, you can download them from the net as well. Yeah, I mean, those are also books, microbiology, pathology, general pathology, but of course, the tutor will give you guidelines and will give you like a summary how to read and what to read, and that will be better for you. Next, please. And we have books that we use for both part 1, part 2, all college, Royal College stuff. It's fine. Also physiology, you have to master one, master Oxford, Oxford dentistry and master collection of dentistry. They are good. I like them. Also, we have some folders or PDFs. Yeah, you can send here anytime. Recommended from the guidelines. Next, please. Recommended PDF from the Royal College of Surgeons. And then we have, I think, those books, they're available either from Amazon or download. You may download some of those from the net, or we can, of course, yeah, I don't know how you can get it in your country, in your city, but it's not a bigger problem. So will be fine. Should be fine. You may get it. Yeah. Next, please. Here is about a bit about. To be honest, dental material, we do not use dental material in the Royal College of Surgeons. They don't ask about dental materials, but it's okay to know about simple things like this is amalgam, this is composite, this is call it porcelain, this is metal, kind of basic things. So a bit. So you don't have to read books about dental materials, but at least you have to know the physiological property. I mean, the anything about amalgam, how it works, the resistance, the stability, these kind of things. And to be honest, we still use amalgam in the UK. So even if you do not use amalgam, even if you as a dentist, if you say I don't use amalgam now, I don't like it. Okay, that is your opinion, but you are following the guidelines of the UK. You still use amalgam. You have to know everything about amalgam, about stainless steel, about acrylic, these kind of things. Why you have to know about the properties of acrylic? Because if you have a patient with uh, allergy, burning mouth sensation, or the patient is coming to you, he has a problem on his tongue or on the palate, and you say, yes, this is cancer. No, this is not cancer. This is because he has acrylic in his mouth, because he has the denture, acrylic denture in his mouth. It is not cancer. So that's why you have to know about even you are a surgeon. You have to know about acrylic. You have to know about amalgam. You can't say I don't know. I don't use amalgam, so I don't have to know about amalgam. Yes, okay. But if you have a patient with amalgam, old amalgam, maybe 30 years before now, and he's coming to you, he has a problem with the white patches, and you say, yeah, this is cancer. No, this is not cancer. This is because of he has amalgam in his mouth, or because he has acrylic in his mouth. Yeah. Next, please. Also, in endodontics, you have to know you have to be able to know the proper the like how to do apsectomy, how to do why the patient has a cyst in his mouth because he has root canal filling. Yes, this is not your specialty, but you have to know why the cyst or granuloma happened because the patient had maybe uh, not good or poor quality endodontic treatment. Fix appliances, as I mentioned, denture and etc. Yes, yeah. Next, please. I as mentioned that before. So, oh, that is oral medicine. To be honest, you have to read more about oral medicine and oral surgery. Also, medicine, oral surgery, a bit of general surgery because surgery is surgery, oral surgery is surgery. It's the same. It's a surgery, right? Oral medicine is and pathology or pathology. Yeah, so you have to be good in that, and because as I mentioned, as I told you, as I gave you the example, if you see a patient with white patch in the mouth, there are many reasons for white patches, and you say, yeah, this is a cancer. Everything is a cancer. No, this is not a cancer. This is a problem in the denture, right? So that is kind of question. Next, please. Uh, you should be able to give the diagnosis and investigations. Oral surgery, of course, this is your specialty. Or if you want to be a specialist, or you are doing the training of oral surgery and maxillofacial, you will be fantastic in that because this is your specialty. Also, orthodontic, it is not, you have to know basic things about orthodontics. And plus, yeah, next, please. Thank you very much, Dr. Thank you. Orthodontic, sometimes, if you're a surgeon, we call it a skeletal problem that the patient is coming to you with the class 2 or class 3, or deep bite, occupied, etc., and you may do surgery for him or for the patient. That is orthodontic, but it is surgery, right? Or the patient is coming to you with severe gum disease or severe mobility in his mouth because of the orthodontic treatment, bad or poor orthodontic treatment. This is orthodontic. Periodontology, to be honest, it is surgery. Next, please. It is surgery, periodontology, and radiology. Radiology, as we mentioned. To be honest, periodontology is surgery. Yeah. Radiology. Yeah. You have to be able to read the X-ray and also the what's called CT scans and etc. That is, I think, removable appliance. We talk about acrylic and denture, etc. And the problem that could be caused by that. Here is professionalism, communication, and leadership. You are the leader in your clinic. You are the head of the team because you are working with your team and you are the head of the team. So you have to know the leadership, management, and also professional. You are a dentist and you are a doctor, you are a surgeon, etc., or physician. And then here, communication. Communication is very important, like how to get the consent, how to talk to the patient according to the rules and guidelines and the law in the UK. In the UK, not other country, in the UK. Yeah. Next, please. And also how to do children, how to treat children. And children treatment is different. Like they are patient, but you have to know how to do the treatment, specific treatment for example. Nowadays we use what we call it laughing gas. We have anesthesia and general anesthesia. You have to know how to use general anesthesia as well. And side effects of general anesthesia, how to use the technique of using general anesthesia. That is also your job. Books, kind of past papers, etc. And yeah, just I want to show you some books that you may use in the future. Next, please. And also, some of you they can have that before because you are doing other examination. And we have also something we call them articles. Articles means like sheets or PDFs and etc. that we give send to you to read about the new regulation or prescriptions and ethics and laws and guidelines and etc. And please don't copy other people because you may get wrong articles. So articles, and also if you do the MJDF2 part 2, you have to know how to read the article as well. They may ask you about how to read the article. How to read the article. I give you an example, very specific example. When you read an article on the Facebook, for example, is about paracetamol. Paracetamol is very easy, or ibuprofen. They said, for example, usually we give the patient simple thing like paracetamol, but the article is about, for example, Panadol. We don't use Panadol. Maybe they use it over the counter. Yes, they use it. Yes, they use the Panadol over the counter, but we do not give it to the patient. So you have to be careful about the article, how to read the article. For example, if there is a new medication and new drugs, especially now COVID-19, you see millions of articles about COVID-19 and new medications, and maybe they use medications, they use antibiotics, I don't know, but they use. So you have to be 100% sure this medication is recommended in the UK or recommended in the world, of course. So don't believe any article that you see on the Facebook or WhatsApp or etc. You have to be sure that this article is coming from the Royal College of Surgeons. Next, please. Also, implant. That is, I think, it is good to know about implants and how it works, the technique and the materials and side effects, and how to do the medical, how to take the medical history from the patient, and restrictions of implants, or everything about implants, they will ask you. Yeah, next please. And also you have uh, to know how to connect between implantology and periodontology. Implantology and periodontology. This is cosmetic. Like, you know, nowadays people using Botox and fillers and etc. Plus, you have something, we use fillers and Botox. Sorry, Botox. We use Botox for treatment. So you have to know how to use like cosmetic dentistry and treatment as well to treat the patient, not just cosmetic. Yeah? So you have to be able to show your ability. Next, please. You have to be able to show your ability to use those things. This kind of articles or the sheets that we use, uh, those are recommended from the Royal Colleges of Affiliate. All right, next please. This is about uh, the bodies or the regulatory bodies in the UK. They publish those articles and we follow that. And sometimes they renew it or they update it. So we have to know the new version as well. Skin cancer and also cancer. You have to know. You should be able to. Of course, I told you you should be able to do the investigation up, probably uh, give the diagnosis, and probably they may ask you to do the flap or uh, the biopsy, and you know the rest of how to take the biopsy and we send it to the lab, and then yeah, those kind of procedures. Next, please. So cancer is and how to diagnose cancer, skin cancer and also oral cancer, right? And other cancer like other organs in the body with cancer like breast cancer and lung cancer, the cause and the metastasis and etc. And then the hazards of smoking. Maybe you don't mind about smoking. You say, this is not my job. Yes, it is our job because smoking is the first cause of oral cancer. So you have to know how to treat the patient and how to deliver the advice to the patient and how to convey the patient that is bad for you. And so we have protocols and we will, of course, the tutor should teach you that protocol to how to take uh, how to explain the hazards of smoking to that patient, and also hazards of let's call it X-ray, repeated X-rays, and interaction of medication, etc. That's kind of hazard that can cause death. Next, please. And obesity, overweight can also cause many problems. Nowadays, it's overweight nowadays is kind of a medical issue. Emotional communication, how to communicate with the patient, how to understand the personality of the patient, and also some of the patients, for example, we are in the UK and you are treating a patient is coming from the Middle East. So you have to know sometimes, not everything, but you have to know, for example, about our other religion, our other cultures, so kind of how to communicate with people from other countries. Like, I mean, if you are here, so how to communicate with people from other side of the world. Next, please. This is a kind of communication, and also kind of behavior. Next, please. And also kind of behavior, how to behave, how to understand the behavior of the patient. And statistics. Statistics, to be honest, is very, very crucial. How to read the article, how to do the statistics. They ask you about statistics. They ask you about how to do your like yearly or seasonally, or I don't know how, monthly. You have statistics, and we have regulation, and we have, of course, the tutor should show you how to do that. Yeah. Next, please. Problem with statistics is kind of you know how many people you treated, and for example, nowadays COVID-19, we have to do everyday statistics. Every day, every single minute, we have statistics. So you have to know how to do the technique. Now that was the MJDF. Now MFDS, Royal College of Surgeon of Edinburgh. Next, please. This is the Hitler logo, and it is in Scotland. It's a very nice area. It's a very nice city, and of course, is assessment of your clinical and academical or academic ability, and then it is recognized internationally. So it means internationally. It's like England. This is the college, Edinburgh. I like it. It's very nice. I hope you may see it a day. Next, please. Internationally recognized. Everything. Also, England and Glasgow and Ireland, they are internationally recognized. Then the qualification. It depends on the, as I told you, maybe 20 years ago in Iraq it was PhD, diploma. Now it's diploma. I am not sure, but it is recognized as a board exam, and also Royal College of Royal College. This is Royal College. The name is Royal College. And to be honest, it is not easy to get this title. For example, in Dubai, they qualified as I don't know, maybe master's degree or PhD, depends. But anyway, in general, all of those are internationally recognized. If you have one of those, so you may get a job, a good job in Middle East or anywhere. So that is the Edinburgh. The gown is blue, while the gown of England is red, maroon, red. This is blue. The next, please. Hopefully you will get it. And location and venue. So if you ask me about the location, of course you have to go to the website, and you see the location and venue. And attempts, how many attempts? It depends on the college. Royal College of Glasgow, I'm not sure. I cannot be sure 100% to say in a couple of minutes how many attempts. I think it's 4. Edinburgh, I think, is unlimited. It's like England. 5 within 5 years you have to finish. Part is 1 and 2 curriculum. Of course, the tutor will give you the modules, and the books. Of course, the tutor should be able to give you the books, of course, and publication. So you have books, curriculum, modules, books, and publication articles. All right. Next, please. And then the paper consists of it's a bit different, and the questions a bit different, but it's all about the same dentistry, surgery. It's like you are a physician, you are a dentist and a surgeon. Next, please. And the books are the same books. You may see some difference in the article, but the same books. To be honest, they are the same. Next, please. And yeah, I put some questions, sample of questions, but it doesn't matter because yeah. Next, please. It doesn't matter because of I think Edinburgh is more about clinical things. Royal College of England about surgical things. Yeah. This is also a question about surgery. You have a patient with extraction. You extract the tooth and you give them something. He will come back and you put immediate denture and you will come back. It's about different scenario, but modules are the same. Next, please. Modules are the same. It's also MCQs. Now, this is the gown of Edinburgh. It's blue, and hopefully you can put it on one day. Next, please. And of course, the examination is available in the UK, in England, and in Edinburgh. So it's Edinburgh, maybe you will see it in London, you will see it in Dubai, maybe in Baghdad, I'm not sure, maybe in Hawler, I'm not sure. So you have to you have to check the website and see where is the location. But nowadays, I think everything is online. And this is the Royal College of Glasgow, is different. It's also Scotland, but it's different board exam. Next, please. This is Glasgow. The gown is green. So if you are lucky, you can get 3 gowns: red, blue, and green. Next, please. This is Glasgow. I like it. It's a nice city. I lived there. I lived there for a couple of years. It was nice. Members of a faculty of dental surgery. Of course, part 1 and part 2 examination. And then next, please. I think the sample is same as in Edinburgh. Next, please. And same in Edinburgh, but I think Glasgow attempts is 4. Yeah, the modules are a bit different. They concentrate about more clinical dentistry and also oral surgery and oral medicine. And of course, the next please. Of course, your tutor should be able to explain that to you before you start the examination. This is again periodontology or severe gum disease. You have to know the new guidelines, because we have also in periodontology we have new guidelines. In this country we say periodontology is kind of surgery. You have to know the new guidelines as well, the British guidelines. History taking, special test, diagnosis, how to do the diagnosis, X-ray, clinical manifestation, explain the treatment and also a treatment plan, breaking news, and complaint. Complaint is also it is a big issue here, because the patient, if the patient is not happy, they can go to complain. So you have to know the procedure of the complaint and how to avoid the complaint and the law in this country. And everything is in the box and in the articles, and also with the tutor. And then medical emergency. This is very important, because if you are doing your job either in your clinic or in the hospital, you have to know how to do the emergency, medical emergency or emergency treatment to the patient. I mean, if the patient has medical issue, for example, hypotension, fainting, MI, stroke, what else? If the patient has problem with the airways, etc. Or heart disease, lung disease, epilepsy, etc. And then this is the library of the Royal College of Glasgow. And if you, inshallah, hopefully, if you pass the exam, they will invite you, of course, to the city, either in, of course, if you pass Glasgow, they will invite you to Glasgow with your family. You can come and to see this nice library, of course. And if you are a member, of course, you will get benefits of the membership. it's kind of a bit different than London. Part 2, a bit different. Next, please. This is also the whole. Hopefully, when you pass the exam, you can come here and to get your award and to feel like, yeah, it is different world, and it is very nice to have hopefully one of at least one of those. Let me say certificate, diploma, master's degree, PhD, anything, name it, call it anything, but it is related to the Royal College of Surgeons and Physicians, of course. Next, please. I think finish that. Yeah, thank you very much, Dr. Walaa.
Thank you very much for your nice presentation, and we حقيقة أنا بالنسبة لي يعني كلش كنت فرحان أشوف في الصور. أتخيل يوم من الأيام راح أقعد هناك أنتظر يصيحون اسمي وينطوني الشهادة. يعني هاي
الشيء إن شاء الله. يا الله بي إن شاء الله كلكم everyone إن شاء الله.
آمين إن شاء الله. شكرا دكتورة، حقيقة معلومات كلش هواية وحلوة. إن شاء الله مثل ما حضرتك قلتي لي بأنه أنت مرتبة بأنه تسوين فد كورس اونلاين حتى احنا يعني ننزله للشباب ونشوف يعني زملائنا شلون يعني يقدرون يستفادون من هالمعلومات. استفاد من هالمعلومات صراحه، لانه هي هاي انا بس شفت الكتب هالقد هوايه، يعني هاي هوايه كلش.
Yeah, of course. The books are, yeah, I mean, I told you, even if you are a genius surgeon, you cannot read all those books and articles and everything, publication in a year or 2 years. You need 20 years to finish everything. That is impossible. So that's why if you have a tutor to guide you and to advise you, it will be fine. Hopefully you may pass the exam quickly in a year, not a year, say 2 years. It depends. Maybe you are ready now. I'm not sure about your. It depends on the person or the doctor. If you are ready, you may pass it in a year or 2 years. Yeah, but if you are not ready now, you may need like at least a year to read everything, to cover everything. And if you have any question, of course, let me know. Thank you very much, Dr. Walaa, for the invitation.
العفو دكتورة، بالعكس أنا شرف حضرتك، يعني تعبتي نفسك وعندك شغل، وأنا أعرف كل شوية أنت عندك شغل وجاية اليوم متأخرة، بس تعرفين إحنا هم نمن عليك، أنت عزيزة علينا وأخت عزيزة. أنا عندي شكرا، أنا عندي هواية أسئلة راح أسألها لايف، وعندي كم سؤال أسألها إن شاء الله ورا جو. الأسئلة اللي على جو دكتورة أكيد راح يطرحوا أكثر الزملاء. دكتورة أنا ورا ما خلصت واخذت الشهاده، هل صدق يعني يقول انا اذا اخذت شهاده الام جي دي اف، او يعني هو المهم هو شنو الفرق بين الممبرشيب والفellowship؟
الفellowship هو شوي اعلى، يعني it's more than the membership. The membership is the basic thing, and the fellowship you do extra thing, maybe extra year, so you have the fellowship.
تمام، هذا السؤال كلش مهم. الشيء اللي ضحكني ما اعرف منو كتب I'm disappointed، ما طلع اسمي والله ما ادري، كاتب I am disappointed، يعني يمكن على مود الكتب والهوايه.
No, don't be disappointed, please. Don't worry, because if you follow the instruction of the tutor, you will get maybe. I just want to say, if you want to do the modules or the books according to the Royal College of Surgeons, you cannot finish. But if you follow the guidelines of the tutor, you may finish in a couple of months or a year, so which is fantastic. Why not?
So, doctor, you mean we must follow you as a tutor? We must follow you. Then inshallah we can pass the exam because we cannot cover everything. So you must يعني make it easier than for us, right?
Yeah, that's the point. What's the point to follow the tutor to make it easy for you? Yeah.
هاي دكتورة زهراء، هاي دائما زهراء شو تقول؟ تقول منو بالضبط تيوتر على مود الكتب وعلى مود شنو ما اعرف. زهراء وضحي لنا عيني، انا اعرف هسه شنو قصدها. تريد الامبورتنت بوكس انت شرحتيها يعني حكيتي عنها. عراقيه ولا اخو شهاده. انا حسب علمي لانه ما اعرف يمكن فصلت الدكتوره بين ما ترجع.
I don't hear you.
اني رجعت من قد الدكتوره.
What was the question?
تمام. The question about equalization of the qualification of MJDF in Iraq.
Yeah.
يقولون بوزاره التعليم العالي العراقيه عدوها كدبلوم.
It's
صح
okay.
ولا؟
I don't know. I don't know. I don't know. Even if it's a diploma, it's fine. It's not the name. The name is the Royal College, the membership or the fellowship or the Royal College of Surgeons. It's not about what the qualification is. It doesn't matter if it is a PhD or is a master's degree or is a diploma or nothing. No, doesn't matter.
يا دكتور انه يعني دكتوره زهراء وضحت لنا الموضوع. قالت اللي ما اعرف منه هو قصدها she's disappointed because the huge amount of books and she don't know who is the tutor. طبعا التوتر هي دكتوره انعام، هي همينه تنطي كورسز سرعه همينه. حتى اقول لكم بانه الدكتوره تنطي كورسز، ان شاء الله راح ننزل لكم اعلان كامل حتى اللي يريد يجوين دكتوره ان شاء الله احنا نرتب له ونسبق مع الدكتوره.
Don't be disappointed. No, don't be disappointed. I just show you if you follow the book, the like if you go to the Royal College website and you see the books, you will be disappointed, right? But if you follow the guidelines and the books that we give, you will be happy.
ان شاء الله طبعا اكيد. هذا اخو سؤال. السلام عليكم، شكرا جزيلا لك دكتور وللدكتوره. انا حاليا طبيب تدرج، ليس لدي وثيقه من الكليه سوى تأييد موجه لدائره الصحه محافظه باللغه العربيه والجداريه للنقابه باللغتين العربيه والانجليزيه. هل استطيع التقديم بهذه الوثائق علما ان الكليه رفضت تزويدي باي وثيقه باللغه الانجليزيه؟ دكتوره تعرفين احنا بالنسبه لنا بالعراق شويه جامعات العراق بانه ما تنطي تأييد تخرج وهاي باللغه الانجليزيه او وثيقه. شنو هي الشروط اللي واحد يقدر يقدم بيها؟
You don't need وثيقه, you need جداريه.
زين واللي ما عنده جداريه؟
You have لازم عندك جداريه. You have to have جداريه. So if you have جداريه, you send it to them with translation in English. That's it.
يعني يعني جداريه كافيه؟
ايه.
حلو، هاي كلش مهمه هاي المعلومه.
But in جداريه in Arabic and in English. In Arabic.
ما عاد زين، واذا ماكو ان انجلش نقدر نترجمها وهي العربيه نرفعها وياها؟
ايه تعمل you do the translation. You have the original one in Arabic or in Kurdi, doesn't matter, and then you have the translation in English and you send both of them. That's it.
سيف وصلك الجواب. عندنا سؤال آخر. الكتب مثل ما نزلتها الدكتوره، وان شاء الله راح نسوي لكم بها لينك، وهي الدكتوره ان شاء الله بالكورسات مالتها هي توفر الكتب كلها يعني حسب ما انا حكيت وياها. دكتوره اخذنا من وقتك كلش هوايه. حبايبي اذا عندكم اي اسئله اي اسئله عندكم ممكن تقدموها للدكتوره على الجروب، وهي راح تجاوبكم واحد واحد ان شاء الله. واذا اكو اسئله كثيره راح نخلي الدكتوره تطلع لايف بدون ما اني اتدخل.
About the books, you either you buy it from the Amazon or you do it online, download it from any website or Facebook. Download, yeah, easy. And the articles we send it to you. We send the article.
جود. الدكتوره سيف يقول دكتور ممنوع تصدر جداريات الا بعد 7 سنين من الخدمه بالقطاع الحكومي حسب قوانين الوزاره اللي صدرت قبل 2 سنين. زين اذا ماكو جداريه شو نسوي؟
How do you have to have a جدارية. Oh my. You have to have a جدارية because when you graduate they give you جدارية in Arabic. This is in Arabic you have everyone have a جدارية.
والله دكتوره ما اعرف انا لان ما عندي معلومات صراحه، فدا اسال على مود هاي لان هم الشباب دا يكتبون.
I think you have to arrange that with the college, I mean dental school, your dental school and the dental association, they may do it for you. I think this is easy if you ask.
انت قلتي لي اكو شخص ممكن تعرفينا عليه هو يرتب لنا هاي الامور، التقديم للامتحان والترتيبات، يمكن قلتي لي ذيك المره، حتى اذا يعني اللي يريدون يبدون يقدمون ويرتبون وضعهم احنا نقدر نتواصل وياه.
Alright.
ان شاء الله. دكتوره اشربي لك جلاس مي بين ما اني اطلع فاصل ونرجع.
اوكي.
الله يساعدك، تعبتي كل شيء هوايه اكيد هسه صار ديهايدريشن. دكتور اني اشكرك جزيل الشكر. دكتور سيف اني وياك راح نناقش هذا الموضوع. الله يساعدك والله ويساعد كل الزملاء صراحه، لانه هذا الموضوع جدا هذا اللي يسويني ديسابوينت طبعا، انه من حق الطالب الخريج من حقه ياخذ شهاده يعني.
وثيقه لا مش وثيقه، جداريه.
جداريه. بعد نشوف شلون يصير. دكتوره شكرا جزيلا على وقتك الثمين، احنا نشكرك كل شيء هوايه. دكتوره ان شاء الله راح تكونين حضرتك ويانا على هذا البوست، اكيد راح يصير باسئله هوايه، واكيد يعني الزملاء اكو بيهم مشغولين اكو بيهم طالعين، فان شاء الله يرجعون راح تبدي الاسئله وراح تبدي الريكوستات الطلب. اليوم الكل راح يسوي لك طلب اضافه ويتابعوك ان شاء الله. راح ننتظر ان شاء الله حلقات اخرى شويه مور ديتيلز بعد اكثر على كل شهاده، وتعلنين لنا شو وقت حتى تفتحين التقديمات على الكورسز مال البريبريشن مال الاكزام اوف رويال كولج
ان شاء الله. Thank you very much Dr. Wala and everybody and the people who watch me, and have a nice night. Good night. Good night. Good night.
مع السلامة دكتورة، وإن شاء الله نتمنى كورونا ما يبقى ونلتقي.
Yeah, inshallah, hopefully, and stay safe everyone, and be careful and be safe, and thank you very much Dr. Wala, and good night.
متابعينا الاعزاء، مثل ما شفتوا محاضره كانت قيمه جدا، ان شاء الله الكل استفاد من عندها. هسه اجاوبك يحيى. حاليا هو اونلاين بحاله امتحنت بارت 1 اونلاين، بعدين البارت 2 ممكن يستمر اونلاين بعد ما تنتهي الازمه لو يلغي. والله دكتور يحيى بعد ما نعرف لحد الان حقيقه. ان شاء الله راح الدكتوره تكون ويانا باكثر من حلقه، حتى اذا عندكم اي استفسار الدكتوره موجوده هي بالجروب عندنا بدنتلينيوم، منورتنا هي. اي سؤال عندكم ممكن تسالوها اصلا على هذا البوست، وان شاء الله هي ما تقصر وياكم. طبعا كانت على اساس نقدم لكم محاضره عن المسلز اوف ماستيكيشنز، بس محاضره الرويال كولج اهم. ان شاء الله احنا نسوي لكم ريفيو على كل المحاضرات اللي اتفقنا عليها قريبا جدا. ان شاء الله نلتقيكم الاسبوع القادم ويا دكتور محمد، اهم عن الرويال كولج، اهم يحكي عن الاونلاين اكزامينيشن، اونلاين بريباريشن. زميلنا من البحرين اكيد تعرفوه كلكم. ان شاء الله يوم بعد يوم الجروب ده تصير بشخصيات مهمه واساتذه اكفاء، اكيد الكل ان شاء الله راح يستفاد من عندها. اللي يريده من عندكم دائما الدعم، تجيبوا لنا اطباء حتى يستفادون، ما نريد غير هذا الشيء. قد ما يزيد عدد الاطباء يزيد عدد الناس المستفيدين، احنا بالنسبه لنا فائدتنا هي فائدتكم. نشوفكم ان شاء الله الاسبوع القادم، والسلام عليكم ورحمه الله وبركاته.